Brandy Riffe. I'm going to be doing a wound culture. I would be doing my general principles and safety practices. I would identify my patient using my two patient identifiers, doing any assessments that are needed, making sure to identify if my patient has any allergies, or making sure that if they are having any pain and administering any pain medicine if it was needed. My patient does not expresses their pain as a 2 and does not wish to have any pain medicine. So I would don a clean pair of gloves. And I would remove the old bandage using the push-pull method, removing the corners and picking up from the center, looking at the bandage and tacoing it, seeing the drainage and looking at the type, which is serosanguineous, the amount, which would be moderate, the color, which is pink, and the odor, which is not detected, and discarding of that appropriately. Then I would remove my dirty gloves, and I would perform hand hygiene, looking at my wound, assessing it, seeing the site, seeing any drainage, stuff like that, making sure everything is okay. I would don a new pair of clean gloves with my packages. So I have some gauze and some non-preservative saline. So I would open those. To clean my site. And I would open my saline, pour my saline into there, discarding any extra. I would then squeeze off any extra. Starting from the center outer edge, I would clean from the top to the bottom, discarding of that. I would do the same on the other side and discard of that, and down the middle. So then I would discard of any of those extras, and I would use clean dry gauze to pat from the center down, outer edge dry, and then I would do the other side, and then I would do down the center as well and dispose of all of those. Now I would dispose of these gloves and then perform hand hygiene and don new clean gloves. Getting my culture vial swab. And opening it, making sure not to touch my swab. I would pull my swab out, not touching anything, going down just the center of my wound, not touching any of the outer edges. I would remove the center cap and not touch the outer edge and go in. And then I would label my sample according to hospital policy, and I would send that in. And then I would discard and my gloves, perform hand hygiene report.